Good morning to all. I'm Jagriti Mahajan, Clinical Instructor at Khalsa College of Nursing, Amritsar. Today I'm going to discuss the most common topic of psychiatric disorder is anxiety disorder. About 30% of person feel anxiety at some point in their life, and women more experience anxiety as compared to men. There are two terms, anxiety and anxiety disorder. First, I will talk about the anxiety. Anxiety is a normal part of life or normal emotion. Anxiety is a feeling of worry that everyone feel at some point in their life, or it is defined as the feeling of worry or unease or fear about upcoming event or something with uncertain outcome. Anxiety becomes pathological when there is a significant impairment in the functioning of the individual. Anxiety occurs due to stressful event like before an examination or before making a important decision in the life. On the other hand, anxiety disorder. Anxiety disorder is more than temporary feeling or fear. Anxiety disorder is defined as the repeated episode of sudden intense of fear and anxiety that reach a peak within a minute. With the anxiety disorder, the person overreact when trigger their emotion and can't control their response to situation, and their daily activities are also affected. Next is the causes of anxiety disorder. There are some causes of anxiety disorder. First is the genetics. If the anxiety disorder runs in the family. Second is the environmental stress. It refers to the stressful event like death of loved one or childhood abuse, etc. Third is the medical condition. Medical condition in which the heart disease, hypertension and thyroid problem also cause the anxiety disorder. And last is the drug abuse, drug withdrawal and alcoholism also cause the anxiety disorder. Next, I will talk about the risk factor who are at higher risk of anxiety disorder. The person who has the history of mental disorder like depression, childhood abuse, trauma, any type of trauma happened in the family, negative events like death of loved one, substance abuse, alcoholism and low self-esteem. These are some risk factors which contribute to develop the anxiety disorder. Next, I will talk about the types of anxiety disorder. There are several types of anxiety disorder. The first one is the generalized anxiety disorder, in which the person feeling extreme fear or anxiety with little or no reason. Second is the panic disorder. It also called the panic attack, in which the person feel extreme level of fear all of sudden and bring a panic attack. The symptom of panic attack are quite different as compared to other types, in which the chest pain, choking sensation, heart palpitation or having a feeling of dying. Next type is the specific phobia. As word indicate, the specific means the fear with a specific situation or specific object. Example, fear of height or flying, etc. And next type is the social phobia. It is also called the social anxiety, in which the person feel overwhelming and self-conscious about everyday social situation. And next type is the separation anxiety disorder. This type of anxiety is mostly seen in the kids. When kids are separated from their parents or their loved one at the time they feel extreme type of fear or worry. So these are all about the types of anxiety disorder. Next, I will talk about the symptoms of anxiety disorder. There are many symptoms of anxiety disorder. First is the feeling of nervousness, restlessness or tense, having a sense of panic, dry cough, dry mouth, chest pain, choking sensation, shortness of breath, tachycardia, vomiting, diarrhea, nausea, muscle ache, stomach ache, headache, shortness of breath, etc. And person has too difficult to take the decision in their life. So that's all about the symptom of anxiety disorder. Next I will talk about the treatment. Treatment basically divided into three types. First is the psychotherapy, second is the medication, and third is the self help, or we can say self care. First I will talk about the psychotherapy. Psychotherapy is the best treatment in the anxiety disorder. Psychotherapy, or also called the counseling or talk therapy, in which the therapist give the education to the person and counsel the person regarding the disorder. In psychotherapy, the cognitive behavior therapy are widely used to treat the anxiety disorder. In cognitive behavior therapy, the thoughts and the behavior of the person are modified, and it is the best treatment to treat the anxiety disorder. Second step is the medication. There are some medication used to treat the anxiety disorder. The first medication is anti-anxiety drugs such as benzodiazepine, and second is antidepressant, third is sedative, and fourth is the beta blocker. So these are some popular drugs to use to treat the anxiety disorder. The third step is to treat the anxiety disorder is the self-help, or we can say the self-care, in which the person learn about the disorder. The person has to knowledge about their disorder, about the symptom, and about the treatment. And next is stick to the treatment plan. The person has fully knowledge about their disorder, so he take the treatment at proper time. Cut down the food and drink which contain the caffeine, because caffeine stimulate the fight or flight response and worsen the symptom of anxiety disorder. Next is don't use alcohol and recreational street drug. Eat balanced and regular meal, because if the person take the proper balanced diet, it will help to reduce the symptom of anxiety disorder. Keep a journal. Write down the thoughts in a diary, so it will help to see the pattern of thought. Next, download the app which offer the relaxation exercise such as deep breathing exercise. When the patient or person suffer with the anxiety disorder, at that time person to count 10 slowly, 1 to 10 counting slowly. Think about what you can change and confront anxiety head on, so that feeling of anxiety reduce. Take proper rest, make it priority. Spend more time with family and friends, because the feeling of person is ventilate at that time. Seek help. When person experience traumatic event, at that time person to take help from the counselor or self-help group. So these are some tips to manage the anxiety disorder. There are some other tips which are helpful to reduce the anxiety symptom, such as sleep at least 4 to take the sleep 4 to 6 hour minimum. Do the exercise, do the breathing exercise, yoga and meditation. These are very helpful steps to reduce the anxiety. Third, read self-help book which help to reduce the anxiety. And talk to professional at the time of anxiety attack. And last, call break or take a break from the social media. So these are some tips to reduce the anxiety symptom. Thank you.